Welcome to 2024 Open Enrollment. This presentation will provide an overview of what you need to learn and do so that you can enroll in benefits for next year. We'll cover what's new for 2024, steps to enroll, and resources to help you learn more. Open enrollment for 2024 benefits will be held November 1st through 15th. This is your opportunity to enroll in benefits for next year. You must take action and enroll if you want to have medical coverage in 2024. Your current medical coverage will not carry forward. This means if you don't enroll, you will not have medical coverage beginning January 1st. The benefits you select during enrollment will be effective January 1st through December 31st, 2024. Once enrollment ends, you can only change your benefits during the year if you experience a qualifying life event, such as getting married, having a baby, or adopting a child. You also must enroll if you want to participate in a flexible spending account or in the vacation and PTO cash-out program. Benefit-earning employees working 20 or more hours a week can participate in open enrollment. You may enroll in healthcare coverage for yourself, your spouse, and your dependent children ages 25 or younger, including stepchildren and dependent grandchildren. You may also cover disabled children who are age 26 or older. You are required to submit documentation that verifies your dependent's eligibility before you can enroll them. A list of required documents is available in your benefits guide or on the bridge on the eligibility page. Each year, Hennepin County takes a close look at our benefits package to make sure the dollars we spend are invested in meaningful programs. For 2024, we have some updates. Let's take a closer look. In 2024, Hennepin County will offer a single health plan to employees. This plan continues to be administered by UMR for medical coverage and OptumRx for pharmacy. You continue to have flexibility and choice in the providers you can see through the nationwide United Healthcare Choice Plus network. In 2024, the plan includes a low deductible of $300 for employee-only coverage and $600 for families. You also continue to have low copays. Office visits are $20, and if you've earned the health incentive, your office visit copays are $0. Lastly, prescriptions continue to be available for a copay. It's important to note that your prescriptions are not subject to the plan's deductible. Let's look closer at how the plan works when you visit an in-network provider. The health plan pays 100% of the costs when you see a provider for preventive needs, such as an annual exam or health screening, for mental health office visits, or when you use virtual care through Teladoc. Then, anytime you need to fill a prescription, you'll pay a copay or a flat fee. Copays for prescriptions are either $20 for generic or $50 for preferred brands. The plan then pays the remaining cost for those prescriptions. Next, for all other services, you must first pay a deductible of $300 per individual, up to a maximum of $600 for families. Once you meet the deductible, you pay a copay or coinsurance each time you receive care. All other costs for those services are paid by the plan. Lastly, your total out-of-pocket costs are protected by an out-of-pocket maximum. If your deductible, copay, and coinsurance costs for the year meet the annual out-of-pocket maximum, the plan then pays 100% of the remaining costs for the year. For 2024, there are no changes to dental or vision coverage. The dental plan continues to be administered by Health Partners, and the vision plan is insured by IMED. Coverage for both plans remains the same, and there are no increases to premiums for the fourth year in a row. The table on this page shows the employee costs per paycheck for medical, dental, and vision coverage. For 2024, health plan premiums will increase. These premiums reflect plan costs for 2024 and more closely align with 2022 rates. There is no increase to dental or vision premiums. Next, there are some updates to the flexible spending account contribution limits. As a reminder, flexible spending accounts, or FSAs, are savings accounts that set aside pre-tax money from your paycheck to be used for specific expenses. The healthcare FSA annual contribution is increasing to $3,010, and the carryover limit is increasing to $610. If you are currently participating in a healthcare FSA, any remaining balance in your account over $610 will be forfeited. You have until December 31st to incur expenses and until March 31st to submit for reimbursement. The annual dependent care FSA contribution will remain at $5,000. This account does not allow a carryover, so please plan carefully. You do, however, have a grace period, which allows you to incur expenses past the year end through March 15th. Any reimbursement requests must be submitted by March 31st. The adoption FSA limit is increasing to $15,950. Like the dependent care account, there is no carryover allowed, and you have the grace period to incur expenses until March 15th. Lastly, the county offers a parking FSA. This account can be used on parking-related expenses at non-county parking lots. This account works a little different from other FSAs. You have a contribution limit of $300 per month for 2024. The money in your account rolls over each month, but you only have 180 days from the date of the expense to submit for reimbursement. This FSA is also unique in that, unlike the other FSAs, you can enroll, stop, or change contributions during the year. Except for the parking FSA, you must enroll in all other FSAs each year during open enrollment to participate. There are a couple other highlights for 2024 enrollment. First, the Vacation and PTO Cash Out program will again be available in 2024. You will be able to cash out up to 50 hours of vacation or PTO. To be eligible, you must first choose how many hours of PTO or vacation you want to cash out during open enrollment. Then, you must earn the hours in 2024. Hours earned in prior years are not eligible to cash out. And lastly, you must also have enough hours in your PTO or vacation balance by July 13th to cover your cash out. No partial cash outs can be made. The cash out payment will be made on August 2nd, 2024, and it will be based on your rate of pay at the time of the cash out. And lastly, don't forget about your health incentive. When you earn the health incentive for 2024, you'll receive $20 off your office visit copays next year. For the 2024 health incentive, your last date to earn and track points is October 31st. Beginning November 1st, you can start earning and tracking points for 2025. As a reminder, if you cover your spouse on the health plan, both you and your spouse must each earn 3,000 points to receive the family health incentive. To check your health incentive status, track points, and find more details, log on to the LiveWell portal at umr.com. Once you're logged into umr.com, select the LiveWell tile at the bottom of the screen. Open enrollment is November 1st through 15th. This is your time to take action. Remember, enrollment is required. If you don't enroll, you will not have medical coverage next year. To enroll, first, take time to learn about your benefits. Resources, including enrollment information, a benefits guide, links to provider lookup tools, FAQs, and more are available on the bridge at bridge.hennepin.us/open-enrollment. Next, if you're adding a new dependent to your coverage, you must upload the required verification documents in Apex. You will receive an email from HR once your submitted documents have been confirmed. If you do not provide the required documents, your dependent will not have coverage in January. Then, when you're ready, log into Apex between November 1st and 15th and select the Open Enrollment tile to choose your benefits for next year. Be sure you submit your elections or your enrollment will not be processed. Remember, you must actively submit your benefits during open enrollment if you want to have medical coverage in 2024. Once you've submitted your elections, you can immediately review your confirmation statement in the final step. You will also receive a link to your confirmation statement the day after you submit your elections. Please review this confirmation statement carefully to confirm it accurately reflects the benefits you want for 2024. If you need to make changes, you may return to the Open Enrollment tile in Apex to resubmit your 2024 benefits. Any changes must be submitted by November 15th. This concludes the high-level overview of 2024 open enrollment. Thank you for your time. If you have additional questions, you can visit the bridge for more information or reach out to our HR Service Center at hr.servicecenter@hennepin.us or call 612-348-7855. Thank you. Please note that this presentation is a summary of the Hennepin County Benefits Program and is not a guarantee of benefits. It highlights the provisions of your benefit plans, which are subject to the terms of the official plan documents and insurance policies, and may be modified from time to time. A more complete summary of all benefit plans is provided in the Summary of Benefits and Coverage. Where this summary and the official plan documents vary, the official plan documents are the final authority.